All right, welcome back to another serving of PT Meal Physical Therapy Podcast, a potluck of information and insights about the physical therapy profession and practice from experiences of Filipino physical therapists around the world. So today, our guest is Maria Angela Borras, a sports physical therapist. She is the clinical director of the UP College of Human Kinetics Sports Physical Therapy Clinic. She's the rehabilitation coach for the OCR Pilipinas, which was the champion team in the ASEAN Games. She is a chairperson for the Philippine Physical Therapy Association Sports Special Interest Group, and she had her certification in sports injury specialist from the National Exercise and Sports Trainers Association. So, welcome to the show, Anj.
Hello, thank you for inviting me.
Thank you for giving your time for the show. I don't know if you remember me, but this is not the first time that we've met.
Seriously?
Yes, it was, I
I'm
guess,
sorry, I
it was,
don't
I
remember.
guess, 6 years ago in CHK. You were one of my panel in my graduate thesis defense.
Wait, oh my God. So you even highlighted that this was 6 years ago. Now you're giving the people an idea of my age.
Well, you were one of, I think, Dean Gonzalo, Sir John Cagas, and you. And my advisor was former Dean Hilda Uy.
Uy.
Mm-hmm. Yes.
Yes. Oh, okay.
There.
OMG, I'm so old.
No.
Okay.
So there. That's and I keep on
Okay.
seeing posts from PPTA. That's why I invited you to speak and be a guest in the show because I know that you will be able to share a lot of things with our listeners. So before we move on further, could you give us a brief background on how you started in physical therapy, what led you to that profession, and share to us where you're affiliated right now?
Oh, okay. So my first paid job as a physical therapist is actually as a research assistant for my former faculty in UP Manila. So originally, I was waiting for an opening for a tertiary hospital in the Philippines. So let's not drop any company name. So I was waiting for their opening.
Mm-hmm.
And while they don't have opening for the position, I decided to be a part of UP Sports Physical Therapy Clinic because they really lack manpower. Like they just have one physical therapist for 26 varsity teams.
Wow,
So that was
that's a
like
lot.
super difficult. So I told my clinical supervisor that while I'm waiting, I would want to spend my practice here. Anyway, I'm earning something as a research assistant.
Mm-hmm.
So that's how I started basically. And then apparently that specific supervisor or that physical therapist was approved to transfer to another country.
Mm-hmm.
So his post got vacant. And he said he actually offered it if I'm interested to let go of the position I'm waiting for from the hospital and just stay inside UP. So I decided to stay for UP Sports Physical Therapy. So that's how I started. At the moment, as you've mentioned, so I'm affiliated with UP. I'm also affiliated with the national team for obstacle course race. And I also am part of PPTA Sports SIG, as you've mentioned. But I'm also part of SPHERE. It's Sports Physiotherapy and Recreation. This is a specialist center. Like this is basically for rehabilitation related to sports injuries. We are located in BGC, and we have another place in Muntinlupa.
Mm-hmm. Right. So, uh, you mentioned that you were that in that post because there was an opening. Someone left, so that's why you took that position. But was sports physical therapy something that you were considering when you were a student?
No, because originally I was actually looking at pursuing a medical degree
Oh.
after my physical therapy degree. But my clinical rotation at UP Sports Physical Therapy Clinic is my last rotation. So I was there on March. So during that time, since I've already passed all the other rotations, it's more easy to decide on where you decide to go, right?
Mm-hmm.
Like what your specialization would be. And then after seeing how much pressure the college athletes actually have, especially if they're UP athletes, and then realizing that UP is actually one of the top schools for physical therapy, right?
Mm-hmm.
But then the athletes do not have physical therapists. That's ironic, right?
Right.
So I was like, I think I want to stay here
Mm-hmm.
and help my university. Return of service
Right.
because I am a scholar ng bayan after all. So return it to UP. And then I started doing sports very specifically.
Mm-hmm. Ah, okay. So aside from what you've mentioned that you wanted to give back to the community of UP, so what made your stay as a sports physical therapist more meaningful?
Okay. So even when I started handling college level athletes, after some time I was able to handle professional athletes also. So it actually made me realize that the the problems that college athletes would have, like if they cannot play, then they lose their scholarship. It also happened to professional players. If they don't perform well, then they're not even sure if they would have a job next season or next year. So it made my the challenges of physical therapist more than just making sure that the athlete is okay.
Mm-hmm.
It's also helping them to make sure that they still have a source of income. It's
Mm-hmm.
making sure that I could help them physically, but the effect is not just on them because the effect is related to their family because of course they need money to sustain their family. And on the very physiotherapy aspect of it, it's more challenging because you're given this responsibility to decide in a very short time.
Right.
And if you are not prepared, like especially if this is a football match, you need to decide if this player goes out or stays inside the field. If you're not prepared, for sure you'd be scared to death. But the fact
Mm-hmm.
that I always wanted to make sure that I make my players perform better, I would always prepare for that. So I needed to study every time. I needed to learn about the opponents. I also listen to the coach when he gives instruction. So it actually made my physical therapy experience challenging, and it always gives me something to look forward to. So I
Mm-hmm.
never felt stagnant. Like it's
Wow.
not just doing the same thing again and again. There's always something different to look forward to.
Right. You're in the most dynamic area of physical therapy because
Yes,
you don't know what's going to happen in the field, and
exactly.
you're going to handle the most acute of the injuries.
Hmm.
So,
Definitely.
do you have with the dynamic setting? Do you have like a most memorable experience that happened in the field that really tested your physical therapy skill?
Oh, okay. I have different unforgettable experience, I
Uh
would
huh.
say. Some because of the gravity of the injury.
Mm-hmm.
So I had players who collapsed during training. This is not even a game. This is training
Wow.
due to concussion. So I've actually seen real time seizures happening
Wow.
and collapsing players and people panicking. So I
Mm-hmm.
needed to be the only one who wouldn't panic
Mm-hmm.
because of course everyone else is getting crazy. But
Mm-hmm.
I've also seen the usual sports injury. I would say usual because of course, we've handled lots of cases. I would see different versions of ACL injury. There would be ACL injury that would be seen as very emotional, that in the end, I got depressed also.
Wow.
But of course, I also saw ACL injury wherein the players are just, okay, I know this is ACL injury. We need to get MRI the next day. You know, it's not just about the injury per se. It's about what's connected with the injury also.
Mm-hmm. Wow. Wow. So you mentioned that you're also part of the decision making right then and there. Um, and you're the physical therapist of the team. Do you have other medical professionals along with you during trainings or games?
Hmm. So during, by far, the teams that I've handled have physical therapists as their main medical professional.
Mm-hmm.
So by the rule, I would be the one deciding during
Wow.
that specific time.
Uh-huh. Wow.
I know
Wow.
in other countries,
Mm-hmm.
each team would have their own sports doctor, their
Mm-hmm.
own ortho doctor,
Mm-hmm.
and physiotherapist and athletic trainer. But this is the Philippines.
Uh-huh.
So I'm the only medical practitioner on the
Oh.
with the team.
Uh-huh. Uh-huh. Gotcha. So you also mentioned that you're also part of the training. So do you also have a input when it comes to strength and conditioning of athletes?
Yes, by far all the teams that I've worked with
Mm-hmm.
have um, have coaching staff that
Mm-hmm.
are aware of what a physical therapist is.
Mm-hmm.
So we can easily communicate. Like I could give suggestions on how we should be modifying specific strength and conditioning program for specific players. So yeah, I could actually do that. We can
Mm-hmm.
even suggest to our head coach in terms of
Uh-huh.
planning the training recipe for the day.
Wow, that's great because I don't know if like that before like physical therapists are just seen as like someone who would just handle injuries, but it's good to hear that they now recognize the role of physical therapists even in training and
That's
not just in injury. Ah, that's good.
Yes, I
Mm-hmm.
think I'm so privileged with it. I'm so blessed with the opportunity to work with this specific teams because the
Mm-hmm.
staff already are aware and even the players are aware of the role of physical therapists. For sure, some of the physical therapists who's also in sports, not all of them would be working with coaching staff who are aware of their job as physical therapists.
Mm-hmm. Right. That's nice. Good. Back then, I remember I also wanted to be a sports physical therapist. I applied in what do you call this? In Philippine Sports Commission.
Oh, okay.
Because I thought like a selfish reason was if I become a sports PT, that would force me to get in shape just to play the
Oh,
role,
yeah,
just
but
to play
that's
the
true.
role. But
Yes,
yeah,
yes.
right. But that didn't happen. I wasn't accepted. the second
Okay.
the second time I tried to be a sports physical therapist was when there was a boom in the football soccer team
Mm-hmm.
seen that there was a clinic that was the official medical partner of that league,
Specific.
and
Okay.
and I applied uh, as a physical therapist, but my BLS certificate was already expired, so
Ah.
so I passed that opportunity again. So the third time was I was speaking with the strength and conditioning coach of ASCAS because we were high school classmates and also colleagues in the college, and they were looking for a physical therapist to be their team physical therapist. And we were talking and talking. Then later on, I found out that they got the physical therapist from the under 19 team and just transferred him to the
Mm-hmm.
ASCAL's team. So I thought, so probably sports physical therapy is not for me.
Yes.
So three times nothing
Okay.
happened. So
Mm,
so
yeah.
so for you,
Like
what? Uh huh.
strikeout.
Right. So probably it's
It's
not
like a
for me.
strikeout. Yeah,
So
that's true.
the destiny is not there. So
Mm-hmm.
so for you, as physical therapists, being in a dynamic profession, what are the things that you did just to keep yourself updated and updated to the current trends of and demands of being a dynamic field of sports physical therapy?
Hmm. One thing is for sure, I never stopped learning. Like,
Mm-hmm.
um, even when I have attended courses on specific techniques, I would actually still attend courses with a specific topic just because I would want to see how another perspective would actually modify the technique.
Mm.
Like the sport, I also attend not just physical therapy courses, I also attend courses originally meant for strength and conditioning
Mm-hmm.
coaches. Um, Initially, like when I was just starting, I even did the CSCS exam.
Oh. Mm-hmm.
But of course, no need to renew it because I was really sure I would want to be the physical therapist and not the because it's a thing now, right? Like you
Right.
mix it. You're both the strength and conditioning coach and you're the physical therapist. So
Mm-hmm.
I did not renew that specific credential anymore and focused on becoming a physical therapist. I also do courses. I also attend courses related to orthopedic manual physical therapy. Of course, that's very much needed, especially when you're on the field and you need to make sure his hip goes back in. Because
Right.
apparently, in European countries where football is very much popular, actually, that's their sport, technically. Um, my players who are originally playing from Europe, when they went to the Philippines, they're actually expecting that the physical therapist here could do manipulation techniques because it's expected outside the country. So I needed to study that
Mm-hmm.
because I needed to keep up. And I also attend courses not directly related to sports physical therapy, but needed in sports. So I also have my anti-doping course. I
Mm-hmm.
also attended courses related to fair play, courses related to gender sensitivity, because that would actually have a role also in
Mm-hmm.
sports.
Right. Keep on learning, keeping updated, right?
And
So,
I watch lots of sports events on TV. And I've attended different sporting events like Olympics, World Cup, just to feel how it is to be part of that.
that scene. Mm-hmm. What are the sports that you play?
Personally, I play tennis. Played because I cannot play now, but never the competitive level.
Mm-hmm. Mm-hmm.
Then early this year, I actually started attending jiu-jitsu classes.
Oh wow.
But of course now it's a problem because jiu-jitsu is very much close
Contact.
contact
Right.
there.
Yeah. So that did that help you in understanding more of like movement and appreciating more of the sports scene, sport physical therapy scene, being engaged in sports?
To be honest, it was not. I was interested in sports and their movement, not because of playing, but
Mm-hmm.
because I've been watching anime, like cartoons related to sports.
Right. So it doesn't matter. Like, so if for example, someone who's not really um, a sports person, like actively playing sports, he can or she can be a good sports physical therapist.
Yes,
Mm-hmm.
because so in UP Physical Therapy Clinic, we actually have student interns. So we always tell them it's not automatic that you need to be an athlete to become a sports physical therapist. It's an advantage, definitely.
Mm-hmm.
But as long as you have interest in biomechanics, in sports, the main thing is you're interested with what's happening in that specific sport. That could already give you a good advantage.
Right, right. And you are the rehabilitation coach for the OCR Pilipinas team. So, could you tell us more about what OCR is and what being a rehabilitation coach means?
Okay, so obstacle course race. So when I describe it, I always say this is your Olympic version of American Ninja Warrior. Of course, we cannot use American Ninja Warrior because that's a brand, but that's the easier way of explaining it. So this is like your Spartan race.
Mm-hmm.
Okay, so being the rehabilitation coach was initially, I would not say tough because I've been handling different sports, but it's more of this sports is relatively new.
Mm-hmm.
So when we started pooling for athletes of the national team, you have a mix of professional athletes, but you also have recreational athletes who were able to qualify and became national team players.
Mm-hmm.
Okay, so why was it more challenging? Because of course they have different mindset. It's not like if you handle a professional team. If you handle a professional team, everyone already has this specific attitude, this specific skill, a
Mm-hmm.
specific value. But this is different if you have a mixed pool.
Right.
So basically, we started with explaining to them what a physiotherapist can do for them. Because some of the recreational athletes, they go like, if something is painful, it's okay. But of course, if you're competing, that's not okay because
Mm-hmm.
you want to make sure that you will win and you are at 100% or more. So what helped me was the fact that when this team was formed, aside from me as the rehabilitation coach, we also have different coaches. So we have an obstacle course proficiency coach. We also have a conditioning coach, a running coach, and the head coach. So it was easier in the sense that I can focus on what I'm supposed to do to make sure that they are pain free.
Mm-hmm.
And if in case they are already okay, I could easily endorse them to the next coach, either the obstacle course coach or the running coach. Now, if in case they cannot perform well due to pain, it's easy to communicate also to the head coach that, hey, I think this specific player needs to rest or shall be out of this specific competition.
Mm-hmm. So it's good that in that team you have a lot of coaches, and you can focus. You've mentioned you can focus on what your uh, area is, right?
Mm-hmm.
But so is that? Would you say that is the recipe for becoming champions? Because they were champions in the ASEAN games, right?
Yes.
Mm-hmm.
I would say that is one vital risk. That's one vital ingredient.
Mm-hmm. Mm-hmm.
Because if you it's two-way. You need to make sure that 50% comes from the athlete, meaning how they would take care of themselves, and 50% from the coaches. So the more coaches that you have, or the more specific the coaches you have, then you would be able to, develop a better program,
Mm-hmm.
and it would make it easier for the athletes to train. They don't need to think about anything else, right? Because
Right.
everything has been provided for them.
Mm-hmm. Everything was handed to them already, so they can focus on their
Yes,
performance now, and you would all of the other coaches would take care of the rest.
yes, yes.
Right. And you are also the chairperson of the Philippine Physical Therapy Association Sports SIG. So what is the Sports SIG and what does it do?
Okay. So sports special interest group is a venue for physical therapists who are already practicing in sports
Mm-hmm.
and who are interested in practicing in sports.
Mm-hmm.
So we actually have two types of members. We have those who are already in the sport PT and those who are looking forward to becoming sports physical therapists.
Mm-hmm. All right. So, what are the? Do you have any events or projects or advocacies in line for the SIGs for your SIG?
Actually, the sports SIG has been one of the main SIG of PTTA.
Mm-hmm.
However, it has been on and off through the years. But we have decided to make sure that it would be given focus, given attention now, because the ultimate goal is for all Filipino physical therapists specializing in sports to be a part of a bigger institution for sports physical therapists, and that is International Federation of Sports Physical Therapists.
Oh, nice.
So we are actually, IFSPT had already released like the specific knowledge, skills, attitude, competency needed by a sports physical therapist. So when we restarted it last year, that's 2019, we have been conducting introductory courses very specific to the competency needed by IFSPT. So again, those practicing in sports and those interested in sports would have an idea of what are the specific competencies that they need to practice outside the Philippines, to handle international teams, to be part of NBA teams or to be part of La Liga teams, things like that. The main vision for the SIG is to become part of IFSPT, definitely. Also, we are aiming that once we become part of the International Federation, we would be able to have a voice in the local sporting community, making sure that each professional team or each organized team would have a physical therapist that would be commensurated properly and that would be performing the right job accordingly. So for sports physical therapists, we are very specific in handling athletes. So the competencies that we are developing are geared towards making sure that you train your athlete and you make sure that he or she is ready to compete. So it goes beyond fitness. It's more than making them fit.
Gotcha. Right. So, personally for you, what specific area of sports physical therapy are you most passionate about?
Ah, on a very personal level, like be with all my values and everything, I am really into integrity in sports. That's why I cannot refrain from being involved politically. But on a very professional aspect of being a sports physical therapist, I'm very much into the post-surgery phase, meaning for athletes who underwent surgery, because these are the athletes who would always have lots of concerns. Aside from making sure that they can go back to sports, I need to check if mentally or emotionally are they coping accordingly with their injury.
Right. There's what do you call this? Certain excitement if when you see your post-op patients getting better and gaining more
Yes.
function. So I do understand that because when I was in the hospital setting, you can give out a lot of active and dynamic, and it brings out your creativity if you handle like a
Yes.
post
Yes.
ACL patient
Yes.
or MCL patient. So it's
Yes.
exciting. I get what you're excited there. So so in the UP CHK Sports Physical Therapy Clinic is always, as I see in your in the Facebook post, always hosting a post-grad course on sports physical therapy. What would be the benefits of enrolling in such course?
Okay. So the courses that we provide actually are two types. So we have the independent courses, so usually a weekend of specific topic, but we also do postgraduate course. So during postgraduate course, we actually immerse licensed physical therapists. Like imagine how it is to handle their own teams, decide for their own team. Because if you're a student, yes, you're doing that too.
Time out.
But during, ano nangyari?
Ayan, sige, go.
Okay, so the courses in UP Sports Physical Therapy Clinic, we have two types. So we have the standalone courses, weekends, one topic only. But we also have the postgraduate degree course. So during this time, physical therapists who have already decided that they would want to try sports as a specialization will be able to handle their own teams.
Oh, wow.
So they would be the one deciding on return to play, deciding on talking to the coach if we need to pull up. Basically doing what we do. Now, the difference is before we actually deploy them or assign them to their specific team, we give everything that we know as sports physical therapists to them. So this is like mentoring, really, passing
Oh, wow.
everything, the experience that we have. We are also following the IFSPT guidelines. So all the topics that are in IFSPT, we give it to them. So if you are interested to go into the practice of sports, it would actually be advantageous for you if you'd be able to be a part of the course that we offer.
Mm-hmm. Right. Because I guess in the curriculum of physical therapy curriculum, sometimes students would just have like 1 month of sports physical therapy experience, which would not
Yes.
cover everything that you need to learn in sports physical therapy, right? So, what do you think, for example, what do you think is something that is important in sports physical therapy that you wish that curriculums would have
Mm,
in PT schools?
good question. Just to clarify, actually, some of the universities do not have sports physical therapy at all.
That's true. I didn't have a rotation in sports. Yeah,
Okay,
I
okay,
didn't have, because
okay.
there are just certain number of
Yes,
students that would go in a sports rotation, but I didn't have any sports
yes,
rotation.
yes. Okay. So in relation to your question, um, it is very fortunate that the upcoming physical therapists, the incoming physical therapists, already have a revised curriculum.
Mm-hmm.
They are on outcome-based curriculum.
Mm-hmm.
So during the planning for this outcome-based curriculum, I was actually one of the panelists, or well, one of the experts
Mm-hmm.
that provided information regarding sports physical therapy.
Right.
So it would already be included
That's
in the
great.
outcomes of the next generation physical therapist. Yes,
Uh-huh.
it would not be an optional course anymore. It's integrated already. So sports and orthopedics. Actually, the younger generation at second year level of physical therapy, they already have sports PT introductory courses.
Oh, that's great.
Yes,
Mm-hmm.
yes. So they
Yeah.
already have the preparation, like the mindset, not to be afraid just because it's an athlete. And I think that's the most important part if you're a physical therapist. When you
Mm-hmm.
don't get afraid of your athlete, you need to make sure you can handle yourself, right?
Right. Presence of mind. I think that's what's important for
Exactly,
sports physical
exactly.
therapist. And don't panic.
Yes, definitely. Everyone else will panic. You should not panic. You don't have that option.
Mm-hmm. That's right. Correct me if I'm wrong, because I read before the post Facebook post. It was the course was titled as a residency program for sports physical therapists. Was it titled that way before? And why did you change it back to a post-grad course? Was there any
Ah,
reason for that?
yeah, because some of the participants or the interested participants, they would have confusion with the term residency.
Mm-hmm.
To be honest, actually, probably half um, of the total graduates of our course flew outside the Philippines. So they're actually using the course to use it as credential to practice outside
Oh, how's that?
because it is accredited. I mean, it is
Oh, okay.
acknowledged by ERC. So if they use um, the certificate that we release, it would also be acknowledged outside the country.
Mm-hmm.
So that's why we needed to change it
Mm-hmm.
because we are not the accrediting body to become a sports physical therapist. What we can offer is just learning, but
Mm-hmm.
not the title.
Ah, gotcha. Mm-hmm. Right. Because here in the US, there are residency programs, just like what you're offering,
Yes.
that if you wanted to go or specialize in a certain field, for example, yeah, sports, you would go under a residency or a fellowship program to specialize. So, same thing, you're going to experience everything that you have to experience. You have a mentor, you'll be guided, and you will experience being a team physical therapist.
Mm-hmm.
Then you can sit in the board certification exam. So
Mm-hmm.
it's just like licensure exam, but this is given by the board of sports physical therapists. And if you pass that exam, you get the title of board certified
Yes.
sports physical therapy. Clinical specialist in sports physical therapist.
Mm-hmm.
Physical, yeah. So I thought that's where um, the direction is going now. I thought you're gonna be what do you call this, the pioneers in the residency programs?
What will happen is this is why we made sure that we will be able to reestablish sportsing.
Mm-hmm.
Just like in APTA,
Mm-hmm.
the board or the one that would credential you would be the national organization.
Mm-hmm.
But yes, you can have residency in your affiliate universities, affiliate clinics. So that's our goal ultimately.
All
The
right.
sports sake becoming the accrediting body and look for other universities, look for other teams who are willing to take in our
Mm-hmm.
residents
Right.
for future tests.
Right. That's a good one. That's a good vision. Right. That
I
would
hope it happens.
that would standardize all the what do you call this, specialties. If you're gonna be
Yes,
the pioneer, that would standardize all the practitioners into really specialists. These are the baseline knowledge and skills that you need to possess to be called
a
a
specialist.
specialist. Right. Right.
Yes.
Uh,
Actually, in the Philippines, we are already geared towards that. So years from now, you cannot renew your license unless you are a specialist.
Really? That's even a step up from what is happening here in APTA because the specialty board is optional here. If you want to add credentials to your
Mhm.
practice, then you can get specialized in whatever area that you want. Like me, I did a specialist exam in geriatric physical therapy
And
because
sure.
that's where I'm practicing. So it just makes sense to specialize in that.
Yes.
So yeah,
Yes.
so but that's a great idea that would, as I've said, like level up the specialties in
Mhm.
in, in our practice there. All right. I don't know if there's still uh, thinking in the Philippines in the sports world that it's uh, uh, I'm being careful because I don't want to sound sexist because it's primarily male dominated. Before, sports physical therapy would be mostly male. Were there any challenges or barriers that you faced when you started in sports physical therapy, being a female, or was that already gone when you started your practice?
Actually, this is the reason why I said on a personal level, I am very involved with ethical issues
Mm-hmm.
related to sports.
Mm-hmm.
When I started, so before I handled my own team, I was the varsity PT of a university. But we
Mm-hmm.
know it's different from being a PT of a specific team, right?
Right.
So when I was applying, I was not actually applying, I was endorsed
Mm-hmm.
to be the next PT of this specific team.
Mm-hmm.
But this is a men's team.
Mm-hmm.
The coach was very straightforward. Even when I was already endorsed, he still asked for all my credentials and interviewed me regarding, my choice of men, things like that, because he mentioned that he was afraid that I might end up becoming a physical therapist and getting into a relationship with one of the players. Because apparently it still happens in the Philippines. So,
Mm-hmm.
I mean, you cannot blame them. It's not because they're being judgmental or they're being sexist, but because they have had experience also. But
Okay.
after that, and I was open about it because for sure it's happening. Because I hear stories about that with higher ups, like older people. So I did what he wanted me to do, and everything was okay. And from there on, all the teams that I handled were men's team.
Oh, okay.
I actually never handled the female team. Yeah, my professional teams are all men's team, and I never had problems with that. So I think
Mm-hmm.
it's just a matter of you presenting yourself as a professional and making sure that they would not doubt you. I mean, you cannot
Right.
blame them.
Right. So there's still some convincing there, and yeah,
Yeah,
well, because
you
of the
need to prove
experience.
yourself. Yes, yes,
Right. Right. That's
yes.
something that male physical therapists wouldn't have to go through.
That's true. Definitely.
Gotcha. So, well, coming from that experience, and also when we mentioned that having not having a sports background can also would not be like a big thumbs down on you as a sports physical therapist. What would you advise to everyone who would want to go into sports physical therapy, who has doubts like that I'm not into sports but I want to go there. I'm a female, but I'm afraid that there might be some views towards female physical therapists in sport. What would you advise uh, students or our colleagues probably who want to go into sports but has a lot of doubts?
Um, this is more of an already given fact. Okay, but this would be my advice also. So if you read up on the code of ethics for sports physical therapists, it states that if once you are the sports physical therapist of the team, you're the only thing that you would focus on is the welfare of the athlete. You don't think about anything else. Now, if you would want to go into a team or if you want to be a sports physical therapist, you need to be ready that there will be times that you would forego about your own concerns.
Mm-hmm.
Sometimes you need to make sure the athlete can play. You need to make sure that the athlete could perform, but you're not even sure if you're gonna get paid.
Oh, really?
So that's a big challenge. Now,
Mm-hmm.
if you are really focused on this specialization, the term is you need to transcend more than yourself, like more than your personal need. You need to make sure that you'd be able to handle the pressure outside of being a physical therapist. Also, you need to be open to a very dynamic scenario, meaning the thing that you learned yesterday might be different today.
Mm-hmm.
Also, in the advent of social influencers, in the advent of um, media's athletes, like you have posts of people claiming to be athletes, but they're not athletes, but they have lots of followers. You need to be able to discern. Like you need to know which to follow and which not to follow. Because otherwise, it would be very difficult for you to process, to do your clinical reasoning. And sometimes you might even forget about clinical reasoning just because you saw a specific athlete performing this, you think that's already good. So
Right.
you need to make sure that you still have the most important part of being a physical therapist, clinical reasoning.
Mm-hmm. Wow. And I think that's what's most important because as we've mentioned and discussed earlier, the field is very dynamic. You would handle the acute of the acute, and you will ultimately say if the patient continues or stops. So you mentioned focusing on the welfare of the players and nothing else. Was there any decision or um, event that um, you were stuck in a dilemma of uh, the team would want this player to continue playing, but in your opinion, he shouldn't continue?
Mm. When I was younger, yes,
Mm-hmm.
especially because I'm a young PT.
Mm-hmm.
Of course, the coach would be like, huh, who are you to tell that to me,
Mm-hmm.
right?
Mm-hmm.
So it was difficult initially. But then I think it's not just an isolated case in the Philippines. This is a case all over the world
That's true.
in sporting events. So sports physical therapists now are able to release medical waivers. So
Mm-hmm.
now we are protected. If
Okay.
you still want to make this athlete play, but I've already said as the medical practitioner not to fill them in, then you need to sign this paper to
Okay.
make sure that I don't have any liability for that if in
Right.
case something happens.
Right. Cover cover your butts.
Yes. Yes, exactly.
Right, because you also as part of advocating for your profession, our profession, if someone doesn't agree with our decision and it's our decision and someone wants to go against it, then we shouldn't be held liable for that because we
Mm-hmm.
already said our recommendation and we're sticking to that recommendation. I think that's also a bigger issue when it comes for the to the paid players, right, in the elite.
Exactly.
Yeah, because
Exactly.
they would not be paid because or they have
Mm,
contracts to fulfill,
mm.
right?
Yes, yes.
All right. So I would like to thank you for your time in sharing your experience and your our knowledge with us. Are you ready for the last bites? My last questions.
Yes. Go
Okay.
ahead.
All right. Okay. So my first question is, what is, because I know that you've been interviewed a lot of times for your roles in different teams. What is something that you wish people would ask about you that they often look past, or something that you think is worth sharing?
Oh, okay. So aside from handling sports team, I did handle pediatric clients and I
Mhm.
also do geriatric clients. It just goes to show that human movement is standard. It is across population. So I want people to know that not because I just specialize on one field, I cannot help people on different fields, like
Mhm.
patients with other concerns. Now, the reason why I'm able to do this is because I'm able to integrate knowledge to output. So I hope physical therapists would realize that our profession is output based, meaning we need to look for results. So if you've been doing the same thing again and again, and it just doesn't work on your patient, I think you need to reconsider, no? I mean, of
Mhm.
course, evidence would say this would work, but you need to check on your patient also.
Mhm.
You need to see if this specific evidence is suited for him.
Mhm.
Because otherwise, evidence would not be working. So you would not be able to make your patient better. And this patient would think physical therapy doesn't work.
Right. Mhm. I'm glad that you said that because I think there's a movement in the whole physical therapy profession on specializations.
Mm,
However, the problem with specialization, sometimes the thinking is, I'm a
very
sports
box.
PT. Yeah, I won't
Mm,
handle pediatrics. I won't
mm,
handle geriatrics. I'm in sports PT. You see someone else. But as physical therapists, we are considered as a movement specialist. And as you've mentioned, I agree with you. Movement would cross all stages of someone's life. So whatever you have learned in that box should be applicable and should be also um, can also relate to other people in the lifespan. So that's a good one. Um,
thank you.
so in the realm of area of PT or sports physical therapy, um, who do you look up to or admire?
Wait, are we looking for a sports physical therapist also?
It can be in physical therapy general or sports physical therapy.
Oh, because I'm thinking of athletes also. But anyway,
It's
for sports physical therapist, I am really and I actually follow him and I
mm-hmm,
even message him because I really look up to him.
mm-hmm.
He's the national team. He's the physical therapist for the national team of Brazil football, so CBF. Do you know that he's Brazilian, so he's not really good in English before. But because he is very efficient, he is now in France, handling the top team of France, PSG,
Oh,
because he was able to prove that language is not important. Well,
oh.
it is important, but the point is, if you know what you do,
Mm-hmm.
regardless of the situation, you would be able to perform. And this is
Right.
what sports physical therapy is about. Even if I am with football clubs for the longest time, if I
Mm-hmm.
go to a basketball club, I will be able to provide rehabilitation program. I will be able to provide assessment because It's standard. It's movement. It's human.
Mm-hmm. Wow. Nice. So, what's the name of that PT?
Bruno and a long last name because
Long
it's
last.
Brazilian. It's difficult to pronounce.
We will search for that.
Yes, CBF physiotherapist.
All right. And you also mentioned earlier that you wanted to mention a an athlete. You can also mention that. Who do you admire? An athlete that you admire.
Oh, I am really looking up to Joshua Kimmich.
Mm-hmm.
He's number 32 of Bayern Munich.
Who's that? What sport is
He's
that?
a
Sorry for my ignorance. Football.
German
Uh huh.
football player.
Mm-hmm.
He's super young,
Mm-hmm.
like super young to be in the national team to start with and to
Mm-hmm.
be playing for the top team of Germany. But
Oh.
he delivers.
Uh
Again,
huh.
it's not about the age.
Uh huh.
It's about how much devotion you would put on your cap. Because
Mm-hmm.
when I became the director of UP Sports Physical Therapy Clinic, I was a newly grad. So I was already talking to presidents of different universities for internship. And
Wow.
when they arrived inside the clinic, they'd look for Maria Angela Borras, and I'd say, yes, I'm that person.
Uh
And they were
huh.
like, okay. So I'm really inspired seeing how Kimmich, this
Mm-hmm.
athlete, is performing well. And he even mentioned in one of his interviews that when a really good player signed for their team, he himself was starstruck. So
Uh
he
huh.
even acknowledged that there are other players who are better than me. And I
Mm-hmm.
want to be working with them because working with the best players will give me an opportunity to become a best player also, right?
Right. Right.
So yeah,
Right.
I like that.
Mm-hmm. So what he's saying is that he want to be surrounded with the best so that they can uh, improve on themselves and be the best ultimately. Right. Okay. My last question is this is the title of the show is PT Meal. So um, what are the three ingredients that uh, you carry with you or you bring with you in your profession, in your general life that you think are essential? Or in other words, what are the three ingredients that make up Anj Borras?
Mm, okay, wow.
Hmm.
Okay, that's I'm prepared. Anyway, okay, so if this is something that would uh, be involved in both my professional life and my personal life, I would say, first of all, definitely passion. Because if you like what you're doing, regardless of how difficult it is, regardless of the challenges, you would not be taken back. Like you would actually always find your why to move forward. And if you have the why, it would be easy to think of hows. Very easy. It would actually make you very resourceful if you're passionate about something. Second, I would say purpose, because again, if you're passionate about something but you ultimately don't know what the purpose is, this is like just going around and not knowing where you'd end up. So you need to have a purpose. And this is why when I teach, I always highlight why clinical reasoning is a process that you need to master if you're a physical therapist.
Mm-hmm.
Because it doesn't, being a physical therapist is not just one loop. If you don't practice clinical reasoning, if you stop there, then you would think, okay, so I cannot handle the patient anymore.
Right.
But if you know it properly, even if you have two turnabouts or probably five U-turns, you would still be able to figure it out.
Mm-hmm.
Lastly, because I am in sports for the longest time, and I realized how important this is, not just for sports, but for everywhere else, integrity. So you need to make sure that who you are when people see you is who you are when nobody else sees you.
Right.
Especially in sports. You would meet different teams, you would meet different people. You need to make sure that you prioritize your integrity because they would talk about you. In a profession, people would talk about you. But you need to make sure that who you present yourself is who you are really. No pretensions, you know.
Mhm.
It's the last thing that you'd want to do because it's so difficult to keep up with pretensions. So better be the real you. No
Right.
problem.
Because eventually your real self would leak out.
Exactly.
So might as well show your real self and stick
Yes,
to it.
yes, yes.
Right. That's nice. So passion, purpose, and integrity. So again, I would like to thank you for your time and sharing your experiences and those nuggets of wisdom with us. So as a last one, like your mic drop moment, what do you want the audience to take away from this episode?
Okay, since this is about physical therapy, but this is about life also, I hope those who would listen would um, put it in their mind, in their soul, in their heart, to help become a part of a movement driven culture. So let us prioritize movement across ages and not just in physical movement, like movement in terms of the society, be proactive, movement driven culture. There.
Wow. Mic drop.
Yes.
Right. So again, yeah, I really appreciate you sharing those
Thank you.
experiences. I'm sure that the listeners would learn a lot from this and will be inspired. So I wish you luck in your career and your life.
Super thank you for inviting me. I appreciate this also. It's always a good opportunity to share insights because, of course, not everyone would, I would not meet every physical therapist in the Philippines. So with this platform, I'm able to share experience. And I don't know, I might, someone from your audience might want to be a physical therapist. See?
Hmm. Right.
I
So if
really
like
appreciate it.
if someone wants to reach out to you, social media, email.
They could find me on Facebook. That's
Mm-hmm.
Anj Borras,
Mm-hmm.
ANJBORRAS.
Mm-hmm.
Or they could check
You
sportorehab.com.
okay? And you also have your SIG also has a Facebook page, right?
Yes, there is
Ah,
also Sports Physical Therapy Special Interest Group.
all right. You can reach out to that, right? All right.
Yes.
Again, thank you very much, Anj.
Much welcome. Thank
Thank
you.
you.